Wonderful. And I'm Hannah. I work here at Active Answers, and I'm one of the exercise physiologists that work here. I have a particular interest in women's health. I actually have an Instagram page called Her Health Space, which you can see on the right there, that just posts a bit of content about different women's health conditions. So you can feel free to give that a check out as well. But yeah, so today we're going to talk about three main things. So we're first going to talk about menopause, the physiological changes that are happening in the body. Then we'll move into how a combination of both diet and exercise work together to help us thrive through this stage of life. Beautiful. So just a little bit about menopause, which I'm sure a lot of you know about already. But menopause refers to the end of menstruation. So when we haven't had a period for 12 months. It can start anywhere between the age of 45 and 55, but in Australia, on average, women experience it around 51, 52 years of age. It can also occur before this, so through surgery like hysterectomies, or from chemo or radiation because the ovaries stop producing estrogen. That's when it can come on a bit earlier. And there are three distinct phases. So we have number one, perimenopause. So that's when you might start to see those fluctuations in our estrogen and progesterone hormones, or our two sex hormones. And we also might start to experience irregular periods at this time. So you might get frequent or less, like more frequent or less frequent periods. And you also might get heavier or lighter periods, as well as some mood changes and some other menopausal symptoms. We then move on to menopause, which is when you have your final period. So you won't know that you've had your final period until it's a year after, which is when we go into our postmenopausal phase. So that's when it's been 1 year since you've had your final period, and you'll be referred to then as postmenopausal for the rest of your life. So I'm sure you know as well, but some of the symptoms that you can see apart from the regular periods and mood changes is vaginal dryness, hot flashes, sore or tender breasts, chills, night sweats, sleep problems, headaches, weight gain and slowed metabolism, thinning hair and dry skin, as well as some problems with cognition. Now, as I said, there's these two main hormones, estrogen and progesterone, that I was talking about. So if you see here, in the fertile years, it's at that high, stable level. When we hit perimenopause, that's when you see those fluctuations in the hormones. And then when we enter that postmenopausal phase, it's that big drop, and it stays low then until we die. So, majority of those menopause symptoms that I mentioned before can be attributed to both of these hormones. So, estrogen causes the most menopausal symptoms, and those symptoms involve reproductive function, metabolism, fat storage, thermoregulation, so our temperature, and our response and recovery to exercise, whilst progesterone is more responsible for our mood changes and anxiety and irritability. So whilst that's happening, there's also a lot of changes that are happening to the systems in the body. So in our musculoskeletal system, which are our bones, muscles, joints, tendons, and ligaments, we see that more rapid reduction in bone mineral density, in our tendon degeneration, in our skeletal disc degeneration, and also in a loss of muscle mass, and that includes our pelvic floor muscle mass as well. So that's why it's quite common as we get older to experience that urinary incontinence and stuff. It's because without doing proper pelvic floor exercises, the muscles are going to become weaker. Then we have our cardiovascular system over here. So that's our heart, blood, and blood vessels. Here we see an increased risk of cardiovascular disease due to changes in blood vessel elasticity. So the blood vessels become stiffer, and that increases our blood pressure. And then we also have changes in our cholesterol levels. So increase in our low density lipids, which is a bad kind of cholesterol. And then we have a reduction in our high density lipids, which is the good kind. And that's when you see that buildup of those fatty deposits on the walls of our blood vessels, which means that it narrows our arteries, so it's less blood coming through. And then lastly, over here, we have our metabolic system. So that's our energy production, nutrient processing, and hormone regulation. So we see that reduction in metabolic rate, which contributes to weight gain, and it's especially seen usually around the waist area, as well as an increase in insulin resistance. So insulin resistance is when the cells stop responding to insulin, and so we get that buildup of sugar in the bloodstream then. All right, so now that we've covered that, we're going to talk a bit more about how exercise and nutrition can then work together to help us through this phase of life. So first of all, how are exercise and diet actually beneficial? So number one, helps with our symptoms, and number 2, just our general long-term health outcomes. So if we see here, it can help with the management of our vasomotor symptoms. So these are symptoms that relate to the constriction and dilation of blood vessels. So that's our hot flushes and our night sweats. It can help with our psychological symptoms, so depression, anxiety, impaired memory and concentration. It can help with our musculoskeletal system, so those joint and muscle pains and tendinopathies, headaches and dizziness, as well as our urinary and fecal incontinence and pelvic organ prolapse. In post and perimenopausal women, we can also see a maintenance of bone mineral density, sometimes even an improvement, a reduction in the risk of developing cardiovascular disease, improved endothelial functions, that's what controls our blood flow, improved insulin sensitivity, a reduced risk of developing metabolic syndrome, so that's a group of conditions that can increase our risk of diabetes, stroke, and cardiovascular disease, improved quality of sleep, and also improved mental health, well-being, and quality of life. So if we go back to those systems that I talked about before and how menopause had an effect on them because of the estrogen and progesterone, we now see that exercise plays a role in all of those body systems. So if we look again at the musculoskeletal system, we see that resistance training, so our strength training, and pelvic floor muscle training can load our bones, muscles, and tendons to maintain and reduce the risk of osteopenia, osteoporosis, and fractures, of pelvic floor dysfunction, so that urinary incontinence and pelvic organ prolapse, and also of the chronic joint pain, so our osteoarthritis. In the cardiovascular system, that's more related to our aerobic exercise. So that improves all cardiovascular health markers and it can reduce the risk of atherosclerotic changes. So that was that build-up of the fats, cholesterol on the sides of the artery walls. And then lastly, our metabolic system, we see that just moderate intensity exercise, whether that be resistance training or aerobic training or a combination of the two, can improve our insulin sensitivity. So by improving it, those cells respond better to insulin now, and they help the sugar move into the cells and therefore lower the blood sugar levels that are in the bloodstream. So you might then be wondering, okay, well, how much exercise should I be doing? So I need to be doing aerobic exercise and I need to be doing resistance training. How much of each do I need to do? So aerobic exercise, which is your walking, running, swimming, cycling, anything that gets the heart rate up, you want to be aiming between 150 to 300 minutes per week, which is about 30 to 60 minutes on most days of the week of moderate activity. So moderate activity was if I was going for a walk with a friend and we were chatting, I'd be able to maintain that conversation with them, but I would be getting quite out of breath. So it's very different to that going for a stroll, grabbing a coffee, or walking the dog where you're quite interrupted in that. Otherwise, we could be doing 75 to 150 minutes of vigorous activity. So that's more 15 to 30 minutes on most days of the week. And that would be if you're doing an activity where you can't maintain a conversation then. Or you can do a combination of the two. So it might be a little bit of high intensity, a little bit of moderate intensity. And then on top of that, we have our resistance exercise. So that's our strength training. So whether you're using resistance bands, your own body weight as resistance, machines at a gym, dumbbells, anything like that, you want to be doing 2 times a week, about 30 to 60 minutes per session on non-consecutive days to allow your muscles to then recover before your next session. Another really important thing that we're thinking about during this stage of life is our pelvic floor, like I touched on before. So it's that we're having that reduction in our muscle mass, and like I said, that's directly impacting also on the pelvic floor. So I usually recommend to anyone that if you are postmenopausal, if you are wanting to start exercising, come in and see someone like myself for a pelvic floor strength assessment before starting that program. If we find then from that there is pelvic floor dysfunction, so if there's any leakage or anything, the exercise that I would prescribe would aim to minimize large increases in your intra-abdominal pressure. So that's the pressure that builds up inside our abdomen that then pushes down on the pelvic floor. And also avoid excessive strain being placed on the pelvic floor and the organs to reduce that risk of urinary incontinence and pelvic organ prolapse. So for example, if one of the exercises that you were doing was running or jumping and that was causing issues with urinary incontinence, I might regress that exercise and do something like a heel drop. So that might be rising up on the tippy toes, coming down on the heels. So it's a bit less impact. You're still getting your impact in then, but it's just regressing so that we can help with the symptoms. So if you already know that you have pelvic floor dysfunction, seeing someone like myself can help you prescribe appropriate exercises and also education on certain modifications, like that one above. So you should have seen on your seat that I have printed out a daily pelvic floor exercise for you to complete. So I know that sometimes with pelvic floor exercises, it's quite hard to understand what's going on there. It's not like when you do a bicep curl and you can feel those muscles working. It's quite difficult. But I thought what I'd do would just run you through first how I explain it to people. Then afterwards, I'll show you 2 analogies that I often use with clients that I find quite helpful. And then I thought we could practice 1 set together. Everyone can close their eyes and I'll run us through 10 repetitions of an exercise and we can just see how that goes. So how I usually recommend it to people is that when you inhale, you're letting your pelvic floor drop down like you're starting the stream of urine. So imagine you're starting to pee. Your tummy will inflate. When you breathe out and exhale, all the air's going, so your tummy will deflate. Your pelvic floor will then lift like you're holding in a wee. You got to hold in that wee for about 3 to 5 seconds and then feel that big relax as you inhale like you're letting that stream of urine start again. When you breathe out, that pelvic floor is lifting up. You're holding on for that wee for 3 to 5 seconds. And then when you breathe in, you let everything go like you're starting the stream of urine again. When people do this though, they tend to tense, especially when they're holding in that squeeze, they tend to tense every other muscle in their body while they're doing it. If you think again about like a bicep curl, we're not squeezing our thighs while we're doing a bicep curl. So we want to isolate that muscle completely and allow every other muscle to relax. So try as best you can when you're doing that to think about while you're holding in that squeeze, am I holding tension in any other muscle? In my glutes, in my quads, any other muscle? Let it go. Try and just hold from that squeeze. So I usually tell people to perform 10 repetitions 3 times in a day, every day, for the best benefits. Or if you can't get to 10 reps, if you just can't hold that squeeze anymore, you do it until as many as you can before 10. So if that's 6, that's fine. That's where you're starting off with. In between each repetition, making sure as well that you're resting between the squeeze. So allow yourself to rest for a few seconds while you're inhaling. And then when you exhale, squeeze and hold again. And to make it most functional, I like to change the position as well. So it might be doing 1 set standing up. It might be doing another set sitting down. It might be doing 1 kneeling. It might be doing 1 lying on your back. So just changing up each set that you do in a different position to let that translate as best as we can into everyday life. So coming to these 2 analogies now. So the first one I like to use is a flower analogy. So if you imagine that when you're breathing in, that's when you're letting that urine stream go, there's a flower that's coming out of your vagina. So you're letting it bloom out. That's all right. And then when you are breathing in, that flower is closing up into a little bud. When you breathe, it opens up. When you breathe out, it closes up. Okay? The second one is our elevator analogy. So with this one, when you're breathing in, you're on the ground floor, the elevator doors are open. When you breathe out, the elevator doors close, you go up to level 1. When you breathe in, you go back down, elevator doors open. When you breathe out, elevator doors close, you go back up. Okay, so I want you to have a think about, of all those things that I explained, which one resonated with you the most. And we are going to quickly, if everyone wants to, close your eyes, and everyone is going to do whatever one they want to. Think about it in your mind. So I'll count us in and out. All right, so right now you're breathing in. Breathing out. Breathing in, letting that pelvic floor relax down. Breathing out, pelvic floor lifts. Breathing in. Breathing out. Breathing in. Breathing out. Breathing in. Breathing out. We're going to do 4 more. Breathing in, breathing out. Breathing in, breathing out. Breathing in, breathing out. And we'll do one more. Breathing in, breathing out. Perfect. So that is one set. So you do that once in the day. You can either do the next two, have a little break, do the next two straight after that, or you could do that in the morning, at around lunchtime, do another set, at around dinner time, do another set as well. Okay, so another really, really important thing going through menopause is our bone health. So bones are living tissues that are constantly being broken down and replaced with new bone in this constant ongoing cycle. Our peak bone mass, which is our maximum size and strength that our bones get, that usually occurs between 25 and 30 years of age. So you can see here on the diagram that it's up there. The higher your peak bone mass is, the better protected you are later in life against bone loss, fractures, and osteoporosis. As you can see though, when we hit menopause, we get that rapid loss of bone and then that continuing loss as we get older as well. So what I really, really stress to people, either if someone comes in and they're over 50 or they've gone through menopause, is I say go get a bone health check. So a bone health check, in it, they will assess your risk factors for osteoporosis. So they might look at your family history, if there's family history of osteoporosis, your calcium and vitamin D intake. And this is done, kind of like I said, every year after menopause or after you've had a fracture as well. Now, if they notice in that bone health check that there are certain risk factors that you have for osteoporosis, your GP should refer you to get a bone density scan. So that is an X-ray that measures our bone density, and it can also confirm a diagnosis for osteoporosis. It can check how much bone loss has already happened, and it can also check if any treatment, so if you're on Prolia, for osteoporosis, if that's actually working. Blood test is another thing that they are also used to check our bones, so in terms of calcium and vitamin D levels, as well as thyroid function, because we know that thyroid problems can also contribute to osteoporosis as well. So speaking of osteoporosis, if you don't know, osteoporosis is when the bones lose their density and they become thin, weak, and brittle, and it increases your risk of fracture then. So if you see on the right here, we have our normal bone over there, so there's little holes here. But the bone with osteoporosis, those holes are much bigger. So you're losing bone at a greater rate than you are reabsorbing bone. Any bone in the body can be affected. The ones listed here are the most common ones, so your hip, spine, wrist, ribs, pelvis, and upper arm, with these three here being the most common, so your hips, your spine, and your wrists. And those are the ones they'll often check in a bone density scan. As we increase in age, our risk of osteoporosis also increases. So 23% of women in Australia over 50 years old have osteoporosis. And as I think I skipped over this maybe up here, but there are often no signs of it. So it's a bit different to osteoarthritis, for example, which is that inflammation. We can feel a lot of pain with osteoarthritis. With osteoporosis, you can go years and years and years without knowing you have it, and it might only be if you have a bone check or if you fracture and then have a bone scan after that, that you'll know that you have it. So that's why, in what I'm going to talk about, the specific exercise for bone health, it's so important to start as early as possible with that. So age is not the only risk factor we have. So like I said, we have family history, low calcium intake and low vitamin D levels, also low levels of activity, smoking, high alcohol intake, premature menopause, so what I said about either the hysterectomy or your chemo or radiation, certain medications, so warfarin and thyroid hormones, medical conditions, so celiac disease, irritable bowel syndrome, diabetes, thyroid conditions, rheumatoid arthritis, and anorexia, and also if you have a fracture over the age of 50 as well, that can put you at risk. I mentioned before a bit about the general sort of guidelines for menopause of exercise, but these are specific to if we want to have an improvement in our bone density. So there are three main exercises here that will help us build and maintain our bone strength and reduce our bone loss. So the first being your weight bearing or impact exercise. So that can be anything where you're bearing your own weight and landing firmly. So that may be like running, jumping, hopping, skipping, those sorts of things. The research says that a minimum of 150 minutes a week, so that was the 30 minutes most days of the week, of fast walking can help prevent bone loss in premenopausal women. And with this, the research says that you want to be doing 50 impacts 3 times a week. So for example, if I was doing those heel drops that I mentioned before, you would do 50 in one lot in one day, then you do it on another day in the week, and one more day in the week. So 3 days a week. The 50 don't have to be done all at once. You might want to do 10, 10, 10. You might want to do 20, 20, 10. Spread it out throughout the day, whatever you would like. The second is, again, that resistance or strength training, but a very specific type. So you want to be doing, let's say I had weights on my shoulders and I was lifting them over my head in a shoulder press. I would only want to be doing about 5 or 6 repetitions of that. But I want to, by that 5th or 6th repetition, it's really hard to get that weight up. It's quite a struggle. And I could only maybe lift those weights once or twice more over my head before I needed a rest. Okay? So it's a lot, like very high load, but lower amount of repetitions performed. So if you're doing something, for example, like Pilates, whilst that's good in general for our health, it's probably not the best thing to be doing for our bone health because it's low impact and also because you're doing about 30 repetitions or something in that. So you're not getting that heavy strength training. And obviously, like I said before, strength training is moving your body against any type of resistance. That could be dumbbells. Depending on the exercise, it could be a resistance band. But again, it would be, you'd have to do 5 to 6 repetitions and that would be challenging. If it wasn't, you'd need to increase to dumbbells or weight machines as well. And why it's so important, because it strengthens the muscles, the muscles around our bones that are more at risk of fracture. So your hips, spine, wrists, we want to help support those joints. And also, obviously, it can have an impact on our bone density as well. So it's really, really important to be doing some strength training. The last one is our balance training. So as we get older, obviously, falls becomes the major cause of bone fracture in women. But we can sort this out by doing some balance training. So you want to be doing balance training to improve your balance and mobility and reduce those risk of falls that are happening. However, you can't just do any balance exercise. It has to be something that is challenging for you. So if you're standing on one leg while you're brushing your teeth and you can do that for a whole minute without feeling wobbly at all, even though it's a balance exercise, it's not actually doing anything then to help you with your balance. You need to be doing something where you feel like, okay, I actually have to stabilize here. And I might need a wall or a bench near me that I might need to tap onto. That's what will have an impact in terms of our balance. So I kind of touched on this, but when you become active or you increase your activity levels, the bones will change their shape and or size to withstand those new lows that they're going through. Once it has adapted to that activity, it will stop changing. So this is why I really hone in on the idea that, again, if we take it back to that shoulder press, if you're doing 5 or 6 repetitions at 4 kilos in each hand, right? And you're doing that for 3 to 4 months, it's not then probably having an impact on our bones. We need to be constantly increasing that intensity, which is what I mentioned here, or changing the activity to continue to stimulate that positive bone adaptation. So you really got to think about, if you're training at the gym and you're doing that, did I only have 1 or 2 left in the tank? Or did I really maybe have 3, 4, or 5? And sometimes if you want to, just give it a go. Just keep going until you can't go anymore on your last set, for example. And then you might say, oh wow, actually I could do 10 more. I thought I could only do 1 or 2 more, but I could actually do 10 more. Probably need to go up in my weight then. All right, well, thank you so much everyone for coming. We both really appreciate you spending your Tuesday night here And if you haven't already, I know that there was a clipboard that went around before with your name and email and stuff. It's now on the desk, the table over there around the corner. So if you want to, I have like a menopause ebook that I've written a bit about exercise and a little bit about nutrition as well. You can also have a little look at it. There's a little one printed out as well if you want to look through that. That's a free ebook, so if you have your email, we'll send that to you so you can have that then. Otherwise, thank you so much for coming.